Welcome to a new type of conversation. With each episode, we'll meet with inspiring people sharing best practices at the forefront of creating change for our young people. We'll talk motivations that make a difference and how their lived experience can help empower us to take action and make a difference in the lives of young people where we live. My name is CJ Sturmer, and this is the Champions for Youth podcast. How do you build a program that actually works, not just once, but over time? Today, I'm joined by Dr. Melanie Bean, a professor of pediatrics at the Children's Hospital of Richmond at VCU and the co-director of the Healthy Lifestyle Center. We're diving into what it really takes to turn something as simple as drinking more water into a hydration movement that is motivating young people to reshape culture in Virginia schools. She reminds us that effective programs require help, and they take time. From unexpected partnerships to giving youth a true seat at the table, this episode explores what happens when we listen, adapt, and evolve alongside our entire community. We talk about the realities of program growth, the challenges, the pivots, and the breakthroughs that come when we stop chasing this idea of perfection and focus on building trust. And yes, it started with hydration, but the ripple effects, those go deeper. Let's take a sip. Hi, Melanie. Thanks so much for joining me today.
Thanks for having me, CJ.
When we talk a lot about nutrition, we think it's sometimes just a one and done thing. And we want to focus on fruits and vegetables and how do we get kids to eat better. But something that you all have done when it comes to healthy living and nutrition is the idea of hydration and water and the importance that actually plays when it comes to thinking about the whole child. Where did this journey to hydration work in Virginia schools come from?
So I'm a behavioral scientist by training. So what that means is I kind of, study how we can optimize behaviors, change behaviors to help reduce disease risk, improve our health. And I always like to focus on children. When we do early intervention, it helps shape our eating and exercise behaviors young and also helps prevent the health problems that tend to develop as we get older. So my work has really always been in the area of obesity prevention, and I do that through treatment studies, kind of more traditionally in a clinic setting. But then I have kind of the other side of my world, which is looking at nutrition policy and how can we make our defaults, so our policy and our environmental defaults set up so that it's easier to make the healthy choice versus a less health promoting choice. And I really love both of those worlds, but the nutrition policy work just has such a huge reach when you think of how many people are impacted by policies, or when you change an environment, it can have just such a huge reach to reaching so many more children than focusing on an individual level type intervention. This work in hydration really has kind of just evolved over the years with growing out of our strong partnerships with local schools and our local community. And it really was a need that was identified by our school district. And that's kind of where we came in as the academic partner with this district.
So you said there was a need with the school district. Tell me a little bit more about that. What was the specific need? What were they missing?
So this district had already been focusing on water. They had passed a model water policy. Really, their school health advisory board had identified that adequate hydration is really important for learning. It's important for cognitive development, kind of these key fundamental skills that are needed for academic success. But we also know hydration is important for good body health, good teeth health, maintaining healthy weight,
right.
And that sugar sweetened beverage intake is excessive, and that the kind of existing policies at the federal level really weren't enough to translate to significant change at the local level. And so this district had passed this policy, and Virginia Foundation for Healthy Youth were really champions of this policy. They really helped them develop it. And it was kind of aspirational, it was really exciting, but the timing really coincided with the first return to school after the school buildings were closed from the COVID pandemic. So implementation of the policy really just had challenges. The school district did a lot of work to really invest in changing the environment. So they replaced their water fountains with hydration stations during this time, these water bottle refill stations, which brought great strengths, which is children prefer these stations to fountains. They're more palatable. But what it also did is added the need for drinking vessels. So without adequate access to a drinking vessel, you really can't use these stations. And during this time, just like a lot of districts, this district did have their water fountains off because of COVID. So it was kind of this evolving, hey, we've got these strengths, we've these things we're trying to pass and really optimize water intake in kids and in our district. But there are these challenges where they were just struggling with kind of how to really implement this policy. And so it's not just implemented as planned, but that it also kind of sticks and helps to create this culture of healthy hydration in the school.
Got it. So people understand that you want to stay hydrated. They want kids to drink water. So they had these water fountains, like there wasn't this actual access, but you started running into this issue of, we have these, let's call it barriers because of the pandemic, is that we can't use water fountains. And then you ran into this other issue. Okay, well, now we can put these hydration stations in, but now the kids don't have anything to actually drink out of because you have to put water in something. So what did you all do to get through that barrier? Were you all able to get the vessels that they needed?
Yeah, so we have a longstanding partnership with this district through other work, school salad bars, different work in the school nutrition environment. And we have a partner called Fit for Kids, and they are also deeply embedded in the schools and have very strong partnerships in the school. And of course, Virginia Foundation for Healthy Youth has done Rev Your Bev programming and in the schools. We've all been partners kind of together for a long time. So this was kind of the time that the district, through these partnerships, reached out and said, like, hey, I think we need to look at this a little more systematically, or can we figure out how can we address these barriers and understand the strengths. We initially had some missteps, which happens a lot, right? Where we said, oh, you need water vessels, drinking vessels, let's give you some. I went to the Children's Hospital Foundation, who's been fantastic partners of work in the community. And they donated water bottles to the district. So I think it was something like 26,000 water bottles. And this was, again, poorly executed, unfortunately, and we take responsibility for this, but they had access, but we gave no guidance. So there was lots of water bottles that looked exactly the same with no names on them. Really little guidance about what are they supposed to do with these water bottles? Are they supposed to stay at school, go home? How do we wash them? Do kids have rules about them? And so it was a little bit of a mess, but it was a good step one where we knew, okay, so access isn't enough. There needs to be some structure. There needs to be some parameters. And really, we realized we just need to be a lot more thoughtful and systematic about how we're approaching this issue.
Right. So it brings up a good point that I think a lot of us tend to forget sometimes is sometimes we can't think of everything. We make mistakes, right? We do the best we can in the resources in which we have been given, but sometimes there are missteps along the way. But I think you said it best is that, okay, well, we have to stop, take a step back, reevaluate. How do we solve some of these newer problems we're discovering to continue to move forward with our goal? How are you all able to, realize what was happening and then make that pivot?
So we sought funding. So we sought some small internal funding, again, from our local Children's Hospital Foundation. And we really were thoughtful about what formative work we needed to do. So we established a community advisory board. That was step one. We knew this was not a academic solution. This was going to be a solution that was a joint solution between, key partners within this district who understood the district, who are living in the district. So we established a community advisory board of parents, teachers, students, some administrators. That actually, we just kicked off our 5th year last night with our board meeting last night.
Oh, wow. Congrats.
Which is pretty cool. Yeah. So we've had just a great consistent, 8 members of this community advisory board, and they've advised us on all aspects of this work that we're going to talk about. But from the very beginning, it was, hey, should we address hydration? Is this the issue we should address related to hydration so that we can really start to understand the strengths that they're bringing to the table and then the gaps? The next step is we conducted what we call key informant interviews. So kind of finding through really collective recruiting, like who are people who can really give a deep dive to understand the hydration landscape in this district. So we recruited wellness leaders within the district, people outside of the district, but who work within the schools. So on health and related programming, and then people related to kind of policy work that was relevant within this setting, understanding the themes that were emerging from these interviews. And then the next step was kind of with our full environmental scan is we partnered with students and teachers within the school districts at all of the elementary and select middle schools. We identified all of the drinking water sources and did an assessment of the quality of them. Is there trash? Does it work? And this really had a great capacity building lens as well, right? Where we were really kind of teaching teachers and students research skills, having them engaged in the process. So it wasn't with academic partners supporting and helping. This was really, a pretty big undertaking, but to get really extensive formative data just to really understand kind of what's happening with this hydration landscape. How can we design an intervention that builds on is importantly delivered by and with our partners at the district versus kind of being a program that's we're going to come in and do this and then leave, right? So that was very important that this was kind of driven by the district to be conducted by the district and hopefully sustainable when the funding runs out.
Got it. So we took a step back to say, okay, well, let's look at the entire landscape. We've run into these barriers. We know we need to do this thing. It's very important. First, you started with unique partnerships and asked for help in different places, which I think is really cool to call out. And then took a pause. Let's evaluate what we have to work with. And then you took it another step further and you brought in thought leaders. You brought in community members and teachers and students to actually have opinions and to bring seats at the table, which we talk a lot about here, about the importance of doing that. To your point, what you just said, don't just create something because we think you need to create something. We know kids need hydration, so let's just make a hydration program and implement it and call it a day. Like, that's not what we're doing here. We're doing something that's a little bit more intentional to make sure that we can create an effective campaign. But now we have this idea of we want to create an intervention based on the information that we have. What did you guys do to start implementing a more efficient and more intentional program?
Where were the themes emerging? What were the ideas that were emerging? And, a good framework that was helpful for us was the social ecological model, right? Which is telling us that an individual's, drinking water behavior is informed by multiple levels. So the individual, their school, in their family, their community, their neighborhoods, and then, kind of at the widest level, the policies that kind of govern all of this. So we made sure that our needs assessment was really kind of assessing all of those levels. And then we designed that intervention to address all of those levels. And we developed an intervention, and where we ultimately landed, whereas there was kind of three key components. There was behavioral reinforcement. So we know, right, they were all evidence-based strategies, right? Behavioral reinforcement. So reinforcing the things you want kids to keep doing. We applied education and outreach to both at the student level, the teacher level, and the parent level and caregiver, and then social marketing. So, and one of the cool things that we did first is some of the feedback that came out was, we need some signage, but we want this signage to be not just super boring saying like drink water, So what we decided to do is partner with a graphic designer. He's an advertising consultant that we've worked with in the past. And we convened a group of student ambassadors. We call them our student marketing ambassadors. And we had Zoom sessions actually with them, which was kind of fun for 4th and 5th graders to really brainstorm with them, get their thoughts, get their ideas for what should this even look. We showed them different advertising ideas for things like how do sugar drinks advertise their products, right? And what we really wanted to do was kind of like turn that on its head and say like, okay, how can we use some of these same strategies to market healthy stuff like water? And so it was really pretty cool.
That is cool. So you introduced them to the advertising that, hey, this is actually what sugary beverages do. It's that's you almost started an intervention program there in of itself.
For sure.
To show them like, hey, what if we use similar tactics to then focus on water and letting them make those decisions? That's really actually really cool.
It was super cool. It's just really great at getting the kids to think. Like he'd give them brainstorming prompts like, how do you feel when you're dehydrated and or give us the most wild story you can think of about, X or Y, or just really encourage them to think really out of the box to get kids thinking and creative and helping them say, why is water important to them, and really probing for them to think about, like, what's it feel like when you're so thirsty and you take that first big sip of ice cold water, like what happens? And ultimately that gave him a lot of ideas. And he kind of came back then with like pitching them some thoughts. Okay, we got 3 possible themes for this campaign. They voted and then they further developed the one they liked. And it was just this iterative process until we came to, okay, here are the benefits of water that we want to promote, which were focus, mood, and energy. Those were the ones most important to them. Here's the theme, which was superheroes. Like all kids love superheroes. So the water bottles turned into these 3 different superheroes. And then the tagline, so make water your superpower. Really just incredible designs and fun posters and floor decals. So that was kind of in itself like a pretty cool undertaking just to develop the marketing campaign that was going to be used within this intervention.
Wow. So not only did you create a seat at the table, and you made it a for us, by us situation, so they were more apt to use it, but you gave them purpose. You taught them sort of almost this new skill set and stretched their creativity. And like, this is ours. We get to implement our own thing. And I would imagine it continued to evolve. They continue to just get excited about it. Did the program continue to expand? Did it grow? What was that feedback like?
We conducted a pilot of it first at 2 schools. A key part of the program is that we have teacher and student ambassadors at each school, and they play key roles in the intervention. The teacher ambassador, she's really like the liaison between the study team and the school, but she's in charge of overseeing the student ambassadors and their work, making wellness announcements and other things in that role to keep that ownership at the school level. The students that this teacher would nominate, they are student ambassadors, and they have key roles also. Of tracking their school's water usage on this like giant water meter we put in the school. They would help kind of the teacher with these tasks, like rotating the trivia out, making morning announcements. And when we interviewed the students at the end of our pilot year to say, what did they like? What could we have done differently? What should we expand on? They were just like, more superheroes. So after that pilot, this is at 12 schools. What we're working on right now is we are expanding on the stories of these superheroes. So we have a new group of student ambassadors. So some were our previous group, but some new ones that came from that were student ambassadors at the schools. And we're further developing these storylines. So identifying what their superpower is, who the villain is in the story, and how can we make these, and we're making graphic novels to really depict kind of a fun story that's, again, reinforcing the educational content of the intervention, but doing so in a way that's a lot more palatable and easier to digest.
Right.
Sometimes than like just telling kids what to do. We just had our last meeting with the kids yesterday to show them, okay, here's the developed storyline, and got some great input. And one of the biggest pieces of input was they want more villains. So, right. So like, yeah. So like tooth decay, the villain, or the dehydration monster, or heat wave.
That's great. Those are really cool villains, very creative. And right. What's a superhero without a supervillain? What are you fighting? Right. I love it. So it's not just this handing out pamphlets and putting up flyers. You're making this more intentional. You have this graphic novel. You have this really engaging way of getting kids to actually absorb the content, to see themselves in the content, right? And it's becoming a very effective intervention campaign because it's something that they created. And I think that's super important.
It really, though, starts with a kickoff. At the kickoff, it's like an assembly. The kids come through. They all get a water bottle that they pick their own decal. So one of the superhero decals to get placed on the water bottle, and a label with their name. And they also pick the color of the lid. So there's 3 different colors. And this was, again, overcoming those issues that we faced at the beginning. The second station, they go and they learn how to clean the water bottle, that ownership and autonomy, because these water bottles will stay at school. They learn to kind of how much soap to use, how to clean them with the bottle brush. And then in the third station, they get to have some experiential activities and get to taste some fruit infused water. So this was kind of a fun kickoff. The kids loved it. And And then, like I said, the kids keep these water bottles at school. So the teachers received, cleaning supplies. So a dish rack, a bottle brush, soap for their classroom. They also receive a laminated sign with like the water bottle procedures and how the kids, what are the rules around the water bottles? When should you refill them? How should you clean them? When should you clean them? Where should you store them? So we provided that sign with a dry erase marker for some rules are set, like only use water in your water bottle, but then others, for teachers have autonomy over deciding kind of the cleaning, storage, and refilling. And then on random days, we would come through the cafeteria. And if we saw children with a water bottle, they would get a cool hydrate wristband, or another decal for their water bottle. Sometimes it was the superheroes. Sometimes it was an emoji or just a cat, or something fun. The teachers also have these reinforcers so they can reinforce what we call smart sippers when they see them. There's some tip sheets that go home to the parent. That education is around, but it's not like kind of in your face.
In your face, yeah.
Yeah. And then some really cool wellness integration lessons, which are designed by our partner Fit for Kids, which align with the standards of learning content. So they're teaching kind of the academic content of, let's say it's a math word problem, but doing it in a way that involves movement and also is reinforcing these key components of the hydration intervention. So really creative way to continue to reinforce the strong body, strong mind, strong teeth. So all of those kind of were launched throughout this 12-week intervention, things to kind of make water fun and cool and get them excited about it. And with the intent and hope that this then is designed in such a way that it really can be sustained with minimal costs recurring in future years.
Got it. So something is so simple as a decal that's small, but unique and something that they want. That's great. And they're doing the behavior to get rewarded. And you're solving a barrier that you had before of let's create some uniqueness. But I like that you're thinking about the whole what if scenario that sometimes we don't think about. It's like, okay, hydration, here's this place to fill your water and here's a vessel to put it in. But okay, well, you also have to store these bottles. You also have to clean these bottles. We also have to make sure they understand the information when they leave the school and how to continue the behavior. And so you all have thought about all these steps as you've continued to evolve, which I think is really important because sometimes we just think about, we want to be intentional, but here's the program. Well, sometimes it can get bigger than that and we learn as we go. And now we're learning that there's all these supplies that came with that. And I would imagine sometimes these things, there's funding that comes with this. How are you all able to think about how do these people pay for all this? How are you all able to think about the funding to continue to make sure these programs could continue every year?
Great question. This initial research study to really test and understand this intervention is funded by the National Institutes of Health. But new things that have come up that maybe we didn't anticipate because we're continually getting feedback from our CAB, from our students, from our teachers about things they like or things to enhance leads to things we didn't budget for. Also, we knew that the water bottles were going to be a recurring cost. And we'd from the beginning been working with the district leaders about budgets and how can they build this into their budget or how can we support them and work with them to partner with current funding agencies to have these recurring costs, knowing we're going to have to replace these every year. But in addition to that, we made sure we really designed the intervention to be very low cost. So once it was in and developed, the recurring costs should be minimal, but they weren't nothing. We are continuing to just seek additional sources of funding. So we received a great grant from NASCAR, the NASCAR Foundation, which funded part of our superhero enhancement. We submitted a grant to CarMax Foundation, which would support water bottles, kind of continued water bottles, as well as some of these costs during the sustainability year that we weren't anticipating we would provide. But so, for example, we'll provide water bottle storage, like these caddies that kids put the water bottles in when they're not using them, or the bottle brush or the soap, right? Or the dish rack. The idea was these stay in the school and then the school buys, new soap and new brushes as they run out. We wanted to make sure we could support kind of the key things that are really needed to sustain this intervention. The water bottles is the biggest cost by far. And we enhanced the water bottle based on feedback. The initial one broke a lot. So we had a much better quality one. The kids and teachers were really excited about it, but it doubled the cost. And so we just keep writing grants to local foundations. Our Children's Hospital Foundation are fantastic partners that really help us do this and help us support these initiatives. So we just kind of keep keep writing grants and asking for some funding to support this initiative.
Wow. I think that's a really important thing to call out is you sought unique partnerships in the unlikeliest of places. Like if you were to tell me at any given day that I was going to go to NASCAR or CarMax to ask for money for hydration in schools,
yeah.
You couldn't pay me $1 million to guess that one right off the top of my head. I think that that's such a unique place to seek funding, which is often a barrier for anyone in any program. And you knew these costs were coming. Interventions are not free to do most of the time. And so I think what's really important for everyone to hear is go out and see where funding is available. Sometimes you got to double click and to utilize the partnerships you have to continue to ask and go to CarMax and NASCAR to ask for funding, especially when we're talking about young people. I can't think of many organizations that would be like, no, I don't want to help young people. Like that's not a thing.
Most companies have, an associated foundation that has a mission, right? And you can kind of do these lookups about what is their mission. And, Walmart and Children's Miracle Network, it's kind of those foundation funds can really help fill needs. I think especially sometimes when it's really not, you're not asking for like research funds, right? What we really just needed was like the bottles, we weren't studying the bottles in this particular case. We just,
bottles
needed to be able to replace them and make sure kids had access to drinking vessels, as that's really fundamental. And so really describing the story and what's the purpose of this, but making sure we're finding kind of the right funder who's interested in this type of a gift.
I think that's so important is that you didn't just also show up and say, I need money. It was very intentional about the partnership that you sought, not just with who they were, but you had the information you needed, right? You had sought information from the people that were contributing to the intervention. You knew you were going to need the water bottles and the things that came with that, the stations and the storage and the cleaning. This was all stuff you knew because you were able to have people have the seat at the table to provide input that was using intervention. I think that that's so important. There's this huge, big picture of everything that we need to think about. It's not just sit down, create something in a couple of weeks and get it done. It really does take a village, and it takes asking for help, and it takes unique partnerships in the craziest places and really learning as you go. You have to evolve. You can't just think you're going to do it one and done. I think that that's important. How do we empower people to think like that? Right. In your perspective, we talk to educators and we talk to people in public health like yourself, and we talk to practitioners and medical practitioners, just all kinds of people that work with improving the health of our young people around this country. How do we empower them to think like this? What can we tell them to do so that they can see success like you?
Yeah. I think, community-based participatory research is, growing, thank goodness. I will say this is not the lens that I initially applied to my work when I first started. But now that I'm kind of in it, I'm like, oh, this is it. Like how did I ever do a study without a community advisory board to guide me? And I think it's just really saying like, helpers want to help, right? And I think even often good intentions from helpers come from like, hey, here's what I think might be best, or the science says might be best. But you need to really understand the lived experience of those who you're really focusing on. And like, you need to hear what do they think is best, right? It's going to be more feasible, more sustainable. Again, it's that. And I think approaching it, knowing it, these types of things aren't fast, right? But we did, I think, 3 years of formative work, before we had an intervention.
Wow.
That in itself is a gift that we were able to kind of find the right funder who funded that type of pilot work, which we know is so important to really then have a robust application to kind of fund the big intervention. But yeah, I think it's just really knowing like your community knows itself best. Your community knows its strengths, your community knows its gaps, and having them not just be kind of partners true partners, like having them be true partners that are invested from the beginning, that are not just informing the work, but they are engaged in the work. So it's just a true partnership, and it takes time, and it can't be a one and done, and it's not a in and out, it's just nurturing it and developing the relationship. And it feels so good, it just feels so good when you do it right.
Yeah, it's not a one and done. The unique partnerships are important, but they don't happen overnight.
Right.
And yes, have a seat at the table, but the implementation is also part of that seat at the table. We talked about people want to have a seat at the table, but then make sure that they're coming along the journey, not just giving input, right? Because to your point, these young people, not only they design it and they had input, but then they were actually part of the implementation, and you created this whole, movement within these schools because all their friends were a part of this thing that their friends created, and they want to be a part of the creation. And it was just this domino effect where the community members saw value, right? Because sometimes people say, oh, well, I try to get them involved, but they don't want to stay involved. And it's like, okay, well, are you making them a part of the journey the whole way? Because when you do, you are seeing the benefit of that. It's for us, by us. And then, like you said earlier, we have to evolve. Things are going to come up. So how do we stop, evaluate, reassess, and pivot? And I think that that's important. That's such really great feedback. It's such a great program. Congrats on the success.
Thank you.
On the Hydrate program, we're getting kids to water. So hopefully we can water more young people.
Watch them grow.
Yeah, watch them grow. So we'll be listening. Keep us updated on how we can maybe replicate some of these programs as this continue to develop and you get some new information back.
Absolutely. Yeah.
So Melanie, thank you so much for your time today. This is a really great conversation.
Thank you. I always love talking about our programs and these partnerships. So thanks for having me.
Absolutely.
We've seen it again and again. The only way we can make real change is if we do it together. It doesn't take much, but it does take time, trust, and finding the right people that are willing to show up, pivot when needed, and partner in unexpected ways. Something as so simple as a water bottle can become a spark for bigger transformation when youth are invited and treated as co-creators. Thanks again to the Virginia Foundation for Healthy Youth and Prevention Connections for their continued support. Now go out there and go do good, everyone. Thanks for listening. We'll see you next time.